Conservative leader Erin O'Toole, meanwhile, is blaming the federal government for the, quote, mess he saw while waiting to be tested for COVID-19 at an assessment center yesterday. O'Toole was recently exposed to a staffer who tested positive. He says he and his family waited hours to get tested, only to be turned away because the center was at capacity. O'Toole says he was struck by how many families were also waiting in line. The CBC's John Paul Tasker joins us now with more. Hey, JP. So this story is certainly not unique. There's lots of families in Ottawa we've been hearing over the past few days because they too have been turned away or waited for hours. What exactly is Mr. O'Toole saying here? And he's kind of directing the blame at the federal government, which is interesting because testing is, of course, under provincial jurisdiction.
Yeah, exactly. Erin O'Toole, like thousands of Canadians across the country, had to wait in line last night for hours, and he was turned away from a testing center here in Ottawa. So he had to actually go across the river to Gatineau to a private clinic over there that would test MPs and their families. That was the only way he could get a result. You're right, though. Why is he blaming the federal government for testing? Clearly, that seems like provincial responsibility. That seems like something that's up to the provinces to take care of. Well, the issue here is he's calling out the federal government for not approving any rapid testing in this country. There is no antigen testing in this country because Health Canada regulators to this point have not been satisfied with any of the devices that have been put forward for approvals. And so that means that everyone in this country who wants to get a COVID test has to go line up at one of these centers, one of these public health run type places, to get what's called a PCR test, which does take longer. An antigen test, for example, could be used anywhere, like in a doctor's office or a pharmacy or a long-term care home or even at schools, perhaps, universities, places where we've seen outbreaks. You can get a 15-minute result from those sort of tests. That's not happening here in Canada. So he's blaming the federal government for all these lineups, all these delays at centers, because he's saying that asymptomatic people who are less risky could avail themselves to an antigen test and leave these public health run places for people who actually have symptoms or who have been exposed to someone with COVID-19. We do have a quote board we want to read for our audience here. This is from Erin O'Toole earlier today. He says that Trudeau Liberals have created this mess by refusing to approve other testing methods, despite all our allies having for months multiple tests, including much faster and less invasive methods. And also, of course, from the health critic, Michelle Rempel-Garner, the Conservative health critic, she says Canadians deserve a new plan. Trudeau needs to do his job, get off his rear, spur Health Canada bureaucrats to overcome the inertia of bureaucracy and immediately work to find a safe solution. Enough is enough. So they're saying really the Prime Minister has to intervene here and get Health Canada bureaucrats to get on approving some of those antigen tests.
So a couple of things, just jumping off that point, JP. First of all, we've had a lot of coverage of those lines on our show. And I should say, to be fair, that, provincial opposition parties are blaming the government here. The provincial government saying, you guys should have anticipated that because of the return to school, these lines would be clogged. Today, Health Minister Christine Elliott said that they would be ramping up capacity from 30 to 50,000 regular diagnostic tests in the next 2 weeks. They're also hinting that something is coming to pharmacies. On the second point of these antigen tests, though, of the more rapid tests, we've had a great conversation with Dr. Naylor a few days ago on the show, who also stressed, he said he made a presentation to cabinet about how important it is to get this stuff going, basically, and to devote their attention to it. Obviously, accuracy is somewhat of a concern and has been a concern, but he wanted the government to really pay attention to this file. What have you been able to ascertain from the government about their position on these tests?
Yeah, well, really what we've heard so far from Patty Hajdu, the health minister, and other people in government is that the regulators just aren't happy with what they're seeing from these antigen tests. I should point out, though, the U.S. Food and Drug Administration approved these tests in the United States months ago. They've been available since May in some cases. Thousands of these devices have been deployed across the country. Millions of tests have been run on these antigen testing devices for people, especially in places like nursing homes, where they've been running daily tests and getting those 15-minute results, really in an effort to root out some of the deaths we saw earlier on in this pandemic. What the experts are telling me is that it's just, don't let perfect be the enemy of the good. Of course, there are problems in terms of, like, they're not quite as accurate as the PCR tests that we're seeing at those public health sites, but they're still very accurate. In many cases, 97% accuracy rate within 5 days of infection. So we spoke to an infectious disease expert. He's a professor at the University of Toronto, Dr. Andrew Morris. We asked him about the state of testing in this country without rapid testing. Here's what he had to say about that.
I think we are behind. It is a bit of a shame, to be honest, that we're not further ahead. I'm hopeful that we'll hear some announcements in the next few weeks. I'm definitely looking forward to those. I would have liked to have seen those ready to roll, by Labor Day. But unfortunately, we don't have that right now, and this is harming us. That's for sure.
So Dr. Naylor, Dr. Morris, they are all on the same page. They believe what we have right now in places like Toronto and Ottawa just isn't working. Of course, Vashi, you can believe, or you can imagine that these places where there's thousands of people congregated could be a vector for this disease. It'd be so easily transmissible from someone who has symptoms to somebody else who's waiting in line, many cases with small children. So they're urging some sort of solution on these rapid tests.
All right.
Soon.
Great.
Vashi.
Thank you so much for the update, JP. Really appreciate it. The CBC's John Paul Tasker here in Ottawa. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.